your with your stethoscope. Okay. So head to toe assessment. Head to toe assessment. 5 minutes. This is what I expect you to do. If you have once you have your 5 minutes, your time is up. You cannot redo anything anymore. If you have more time, and I say you can still go back, you can quickly do your head-to-toe assessment from the beginning to the end, okay? And just go, okay, I did my head, all this, face, shoulders, down, arms, and if you touch on one thing and I heard you say it, then I will give you credit for it. And it's not like I missed something. It's gonna be 2 people that's checking you out, so you know when you miss something, it's not just me that's saying you missed it. Okay, so time it up. 5 minutes. Okay, knock at the door. This is what you're gonna do in your clinical setting too, right? Knock at the door. Hello. Hi, my name is Mary Beth. I'm gonna be your nurse for today. Do orientations. What is your name? Lee. And while you're doing that, you're checking the armband. If he's alert oriented. Do you know what day it is?
Thursday.
Thursday, and you know where you are?
I'm at school.
Okay. You're supposed to say hospital. That's all right. So you know alert orientation, yeah, times 3, and sometimes you don't need to. Do you know why you're here? Yeah, sometimes they do. I had this thing, and you know, so orientation times 3 because he doesn't know why he's here. And so I'm gonna do a head-to-toe assessment just to check if everything is okay. Is that okay? Because once you start touching the person, it's assault if you don't ask permission, right? So you ask permission first, okay? And it requires me touching you, right? Okay, so I did the head already, the orientation. So now, if there is no injury to the head or no trauma to the head, there's no sense of you inspecting the head for lice and stuff, right? So what I wanted you to do is, can you smile for me? Neural check. Okay, I'm checking for symmetry, facial symmetry, right? So, and then I'm gonna have shine a light in your eyes. Is that okay?
Yes.
Okay, so okay, and then can you follow the light for me, please? Without moving your head. Without moving your head.
It's all the way down there.
Okay, so you can follow the gaze. Okay, so smile, gaze. Okay, then now I'm gonna touch you. Lymph nodes, right? Any pain when I do this?
No.
Oh, when you're doing the gaze too, you might want to look for anything on the ear too while you're there. Okay? So no pain, right? Can you show your shoulder for me? 11, cranial nerve 11. Okay. Any pain in the arms, right? When you're doing the arm, you do radial pulse both at the same time, right? Check for strength. Pull, push. Okay, good, good job. Cap refill while you're at it. So you got all the arms already done, right? Okay, so now I'm gonna listen to your lung sounds. I wanted you to listen to five different places on the front, right? Okay, 1, 2. And every time your instructions, every time you put the stethoscope, ask them to breathe in and out. Okay? So that's the 5. Okay? And at this point, you can have the patient sit up and do the lung sounds in the back so that you have all lung sounds. 6 places on the lung sounds in the back. Okay? Side, down, across, side, this side. Okay? So that's done. Good job. Okay, now I want to listen to the heart. The heart sounds, I'm listening to the heart sound, no abnormality, right? Apical pulse, 1 minute. All you need to do is say I'm checking for apical pulse and I'm checking it for 1 minute. I mean, you don't have to stay there for 1 minute because you're gonna lose your 5 minutes, right? And just tell me, I'm checking for apical pulse. I just need to know that you know the placement, right? Now, if I hear abnormal sound, what do? I flip this on the other side and listen to the valves. If there's no abnormality, you don't have to listen to the 5 areas of the valves, right? Which is your abdomen, right? While I'm here, I need to check your bowel sounds now. Remember to listen to your bowel sounds first before you palpate, okay? And usually, I kind of lift up their gown and look while I'm doing this, okay? So 4 places, okay? Check the bowel sounds. Now I'm gonna palpate. When was the last time you had your bowel movement?
Sometime this morning.
Okay, that's good. And urine?
Same time.
Okay, so you did that. No abnormalities.
No.
So now you have to go down to the legs. And any pain in this area, right? None? Okay, so while I'm doing this, I'm looking for edema, right? Edema. If I find edema, I'm gonna press on it and see if there's, how bad is the edema, right? You wanted to check your pulses, right? Pulse, pedal pulse, dorsalis pedis, right? And then your posterior tibial is inside, not here, right? Proper placement is right here, okay? And then you go down and check for cap refill. If your patient is wearing socks, take the socks off because you wanted to check, especially when they have diabetes. Okay, you want to check for the bottom of the feet for sores and stuff. And at this point, if you don't know your patient, you might want to use the gloves in checking the feet because you really need to know those for sores, right? Okay, so I checked that. I checked the pulses. Now, can you push towards me? Okay, so like sometimes you can say, can you push like pedal or gas pedal, right? And then pull towards you. Okay, so you're doing the strength, right? And you check for edema, you check for everything. Now, lastly, I wanted to put my hand in their calf area because a lot of people don't know when you say calf, they don't know what you're talking about, right? So you might want to just put your hand on the calf and do your Hohmann sign. Hohmann sign is dorsiflexing your feet, okay, to see if you can mimic pain. Because if they have DVT in there, there will be pain, right? So you dorsiflex this and say, do you have any pain where I'm touching you?
No.
Okay, and then you don't have to switch sides. You can just stay on this side and do dorsiflex on this side too and say, do you have any pain here?
No.
None. Okay, so did I miss anything for hecto? How long did that take?
8 minutes.
Okay, because I explained it. But it's supposed to be just 5 minutes.